Hey everyone, welcome back to the Hoeflinger podcast. We're joined tonight by a special guest, Dr. Webb. He's a board-certified spine surgeon in Texas, and very happy to have you here with us tonight. We're excited to talk to you. We got two surgeons in the house.
Yeah, thanks for taking time out of the busy schedule. Sounds like you're very busy.
Yeah, thank you, and it's a pleasure kind of speaking with you guys today.
It'll be interesting to talk because I'm a neurosurgeon and you're an orthopedic surgeon that specializes in spine, and so many people ask us, what's the difference? What's better, ortho spine or neurosurgery? We get that question all the time, which I always say my answer is that really it's your surgeon. Is your surgeon good? You can have good neurosurgeons and bad neurosurgeons and good ortho spine or bad ortho spines, but do you get asked about that frequently or at all by patients? You're not a neurosurgeon. What do you do anything differently than a neurosurgeon would do?
Yeah, it's pretty interesting because a lot of patients will come in and they'll say, "Hey, you're my neurosurgeon." They'll call me a neurosurgeon. I'll tell them, "Hey, I'm not a neurosurgeon, but we will hopefully be doing surgery soon for your particular case." But patients, they do bring that up from time to time. My hope is that it will come down to a integrated training program, and it seems like that's where it's going.
Yeah,
we're all trained together, so I think that'll be good.
No, definitely. I think that would make most sense because I didn't, in our field, we just train spine every year. We learn spine every year. But do you do in your 5 years of orthopedics? Because I honestly can't say I know. In the 5 years of orthopedics that you do spine during that, or do you only learn spine after the orthopedic residency?
Yeah, it usually starts our second year. So our first year, mostly general surgery, and then some orthopedics. But that second year, that's when we start some spine rotations.
Okay, so you're already in. So it's not just an orthopedic residency, and then you do spine afterwards. You're doing spine all along too.
Correct.
Oh, I didn't know that.
Yeah. So how, for people that wouldn't know, how long was your training, or what, like from undergrad, medical school and beyond? What was your training?
Yeah, so mine was a little bit atypical. I go back to my military. I was in the military for 8 years before medical school, and I was in the Air Force, and I went to school full time when I was on active duty. It took me 7 years to get my undergraduate degree, just because I kept having to drop classes, and I got deployed to Iraq. A couple other areas that we had to go to. So it took me a little bit longer to get my undergraduate degree, but went to medical school at Georgetown. I did my residency here in San Antonio and did a fellowship at the Texas Back Institute out in Plano.
Yeah. Cool. Well, first of all, thank you for your service. And I saw that on your website, but what was it? Did you know you wanted to be a doctor before joining the military, or why you were there, or what kind of, or what was your thoughts there?
Yeah, I've wanted to be a physician ever since a program in high school. So I was accepted to a medical magnet program. I think I was in 10th grade, 9th or 10th grade, and I did that program for a few years. And ever since that program, I wanted to be a physician, and I went to the military to get some medical experience, number one, but also have a way to pay for school. Ended up doing 8 years in the Air Force.
How did you decide on ortho spine?
Orthopedics, I went to Georgetown, so a good portion of students from Georgetown go into orthopedics. I would say at least 25 to 30 per year. And that's just because we get early clinical exposure in our third year of medical school to orthopedics. And so it was really good to see that kind of early on and kind of solidified that decision. But I've always liked working with my hands and kind of building things, put things together. So it really just kind of matched up to my interests.
How many, just curious, so how many years have you been out of practice, out of residency and in practice?
I'm in year 4 now, so coming up on the 4-year mark.
So I got to ask you, so I kind of remember, I've been out for 25 years, but what was it like that first year? It's pretty different, isn't it? Once you get out of residency and fellowship and there's not an attending there and you're the man, like what was it like those first few weeks, those first few months operating on your own? What was your experience?
Yeah, it was actually pretty interesting. And, you come out of training and you think, after residency, fellowship, I got this, I can do a decompression or, ACDF. You get out of practice, and then when it's actually time to perform surgery, you're like, oh, crap. Like, but it was good because I joined a large group of, here in San Antonio, there's about 10 spine surgeons in my group. Mm-hmm. And I was able to, it's like a second and third and fourth fellowship for me. So, I was able to do a lot of posterior cervicals, scoliosis cases with PSOs. I have a scoliosis case tomorrow. I'm with one of my partners who's been in practice for about 4 years. So it's been a great experience just operating with some of my senior partners and just continuously learning. So, but
Yeah.
that first few weeks, few months was it was good to be done and be on my own. But yeah, I can certainly see.
What's for people out there, when we're in residency, it's like a brothership. I mean, you become so close with your fellow residents, and it becomes very fun operating with each other and getting used to that. And then when you get out on your own in your operating room, it can be intense, but you kind of lose that. It's nice to have somebody there. So I enjoy operating with other people nowadays. When I get a chance to do a case with somebody, it's a lot of fun because it's fun being in there with another person who does what you do, can anticipate what might keep coming up. And it's just
Yeah.
it's a different world. We lose some of that, when we get out on our own.
Yeah, it's come in full circle because one of my mentees, since he was an intern, I've been his mentor, and I actually recruited him to my group, and I've been helping him with a lot of his cases. And I
Yeah.
can see, I was like, oh, okay, that's how I was when I first started.
Yeah, I'm sure he appreciates it.
He's a little timid in terms of, should I do this? Like, it's going to be okay.
Yeah.
Yeah.
So,
What are your most common cases? Do you do, like I know with him, like ACDF? What are your most
I
common?
mean, posterior cervicals with or without instrumentation. A lot of lumbar
Because you don't
cases
really
with
do
or without.
scoliosis, do you?
I don't do scoliosis.
Yeah.
No. Usually in our town, really, there's only two people I think orthospine that do scoliosis. It seems more of a orthospine thing.
yeah, my fellowship, we actually had a neurosurgeon who did a lot of scoli cases, so I was able to do some of that in fellowship as well. But most of my practice is degenerative ACDFs, miters, laminectomies, posterior cervicals. I recently introduced PTP, prone transpsoas, which has been a huge game changer for my practice. So it's for the lateral surgeries.
Oh yeah. I saw it came to our hospital. What do you think of is it called the Mazor or what's it called that?
The Mazor.
Yeah, that puts the screws in for you like you plan them. Have you found that helpful at all?
Do
you use it at all?
I don't use the Mazor. I use the Globus robot from time. It's really good if there is a patient has had previous surgeries, like a revision case, or if there's like aberrant anatomy. It's really good because it takes the guesswork out of the trajectory of the pedicle screw.
Yeah.
So it actually gives me a mental break in surgery. So if I have a really complex, long case, I'll use the robot to just give me a mental break, and I could just get my head back in the game when I'm doing a decompression or finishing the case.
So for those of you that don't know what we're talking about, so when you put screws in people's backs, you can do it open, where you actually feel where you want to put the screw in, which I do a lot of. And then there's computer guidance, but now there's a new technique, and you probably know more about it, but it sounds like the surgeon will pre-plan on a computer where the screws are going to go in, and then you make the appropriate incisions, and then through those incisions, the robot will actually put the screws in, right?
No, what it does is it assists you in placing the screws, so you can plan it out before surgery. Let's say you get your medial lateral trajectory, you get the size and diameter, the length of the screw, and in surgery, either a CT scan is performed at the time of surgery, or you can load a CT scan up that they had preoperatively. And then at the time of surgery, the robotic arm is brought in, and I can tell it to go to the left L2. It will go in the exact trajectory, and the robotic arm, I stick my drill down and then put my screw down that drill.
Oh, I see. So it's just giving you the guide. Okay.
Yes, sir. Then I go to L3, and then I go to the right side of L3.
I got you. Yeah. Okay.
How different is that from when you first, how much is advanced
we didn't even have, there was no computer assisted stuff when I was in residency that I know of. It was just all freehand and anatomy, and just like the brain, we didn't have stealth guided, computer systems. We would have these archaic cages you put on people's head called CRX systems that would kind of use 3D coordinates to help us guide our biopsies into the brain. But so much new technology that you probably know 10 times more about than I do because you're on the cutting edge of it. But
yeah, they have what's huge on the forefront is augmented reality, which it's that's kind of a lot of people.
I've seen that.
Yeah, I actually have a headset not too far away from here.
Yeah, you should tell people about that because that's awesome. It's like having a Apple things on or whatever.
Yeah.
Yeah. Explain. Could you explain it? I'd like to hear more about it too.
Yeah, so augmented reality is it's similar to virtual reality, but it's if you put a headset on, like the Apple headset, you can actually see your background, your surroundings, but you can overlay images into the headset. So where it's very helpful in surgery is if you have a patient's CT scan that you upload to the augmented reality headset, I can walk into the patient's room in the operating room and I can see their spine
Yeah.
without even making an incision. So some people refer to as X-ray vision, and that helps me with placing the screws in, so it limits the amount of the incision that's needed. So I'm looking through the headset and looking at their pedicle as I'm putting the screw in.
Yeah.
That's the kind of next level.
So it sounds like it'd be good for people who have like fractures of their back called compression fractures. When you put the cement into
Yeah,
their back, can you just do it freehand, right? Pretty much using those virtual.
you can. Yeah, it would actually decrease the amount of radiation exposure as well. So
Yeah.
so you're not taking multiple shots trying to get your starting point.
That's sweet. I think too, what's interesting is you're earlier on in your career, like you're more willing. I think younger surgeons too are more open to like new technologies, or like if you're
Right.
really ingrained in your ways. I know you've sometimes people, because so many surgeons do different things different ways. So it's really interesting to hear new
Yeah.
things going on.
Yeah, it's a lot of these technologies. The basic underlying premise is our goal of surgery is to
Yeah.
decompress and fuse if
Yeah.
necessary. But
Yeah. And I think, for
anyways,
me as a surgeon, I think you have to do what works, right? I mean, you can learn these new techniques, but I know a few surgeons that I can do an open surgery and have them go home the same day and do just as good or better than someone who does, minimally invasive, little tiny incisions through a cylinder. So it really depends on what you're good at and how your patient's doing, what you find that works for you, I think,
Yep, I totally agree with that.
Yeah.
No, talking about technology too. So we were talking last week with Bob Baxter, who's the president of Mercy Health for the Toledo, Ohio market. It's episode 24. But we were talking a lot about AI and what the potential. He sees so many things in that field, and he was talking about his potential different applications. But I'd be interested to hear: do you guys use AI in any fashion in your practice, or any of your partners?
Yeah,
Whether it be any part in terms of documentation or whatnot.
yeah, AI is huge, and I think it's here that's going to revolutionize how we care for patients and deliver better and safe, more effective care. I currently use it in my practice, and this has probably been the biggest game changer for me in my practice is using AI for dictation. So I use a software that when I walk into the patient's room, I'm not sitting there typing what they're telling me. I'm listening to the patient. It allows me to be more connected with the patient. But I have an AI software that listens in the background, and their history, I usually verbalize my physical exam, and it comes up with an assessment and plan. And that's really revolutionized my practice because before I would either spend late nights or early mornings finishing my note, but now I have this platform that can do that. But we use it a lot in billing, also collections, and for our practice. But yeah, AI is huge, and I think it's only going to get better from here.
Yeah, no, that's the pass. I think he was talking about that is that's like the passive listening device. So you can just focus on the patient and it's documenting. And that's kind of
Yep.
what we were talking about too, is that a lot of people want to see like the kind of like sexy stuff AI can do or in other fields. But a lot of times it's like if it can free up documentation, like you're saying, or billing, that frees up your time to do what you do best in terms of listening to the patient, doing surgery,
Yeah.
everything like that.
As far as, so you say it comes up with an assessment and plan after you put a lot of stuff in. Did you have to teach it what you typically like for an assessment and plan? Or does it just figure out what it thinks should be done? You know what I'm saying? Like, obviously, does the computer have a different opinion than you when it comes to your plan and assessment?
It's usually listening to what I tell the patient. You have a grade 1 lumbar spondylolisthesis.
Yeah.
And then I'll break it down to the patient, but then it listens to that, and then it puts it in an assessment. It's basically what I'm saying. So I'll give the patient my assessment and the plan, and it's basically just taking that from my.
Okay. Yeah. That's pretty neat.
Switching gears a little bit, but this is how I first found you and thought was really cool was multiple years ago. So I started social media with him about 2 years ago. But before that, I don't know if it was about a year or two ago, I'd seen some of your YouTube videos,
Mhm.
which I thought were really cool, like your day in the life ones and whatnot, which I thought were awesome. And then before this, I was doing more research into just how long you've been doing that for. But so you've been doing the YouTube videos for 8 to 10 years, or
Actually, yeah, since I was a resident, I realized that there weren't a lot of surgeons kind of blogging or vlogging online. And I was like, hey, this is something I can kind of introduce. So, but, since then, a lot of people have kind of adopted that into their practice. But I'm also kind of interested in hearing, how does it help your practice? And do you get patients from kind of coming in from seeing your videos? And I know I do. I have patients like
Yeah.
travel from over.
I think for me, it's been more patient education. That's how we started it out. I make videos for my patients, and Kevin has helped me do it. We do it together. And so if somebody comes in, say they have a herniated disc, right?
Yep.
And I explain the surgery to them, patients have a hard time remembering, I mean, it's a stressful situation and they're thinking about other things or they don't understand what you're saying. And so they may forget 80% of what you say. And I got frustrated with people right before surgery, a month later saying, now what are we doing again? They had no idea.
Yeah.
So I said, there's got to be a better way. So what I would do is for every condition that somebody comes in to see me, I have an MRI that corresponds to a generalized idea of that. I'll explain the MRI again.
Hmm.
Then I explain the surgery that they're going to have specifically. And then I talk about all the aftercare and all the typical questions they ask in the office I put in there. So it's like a 13 to 15-minute video. And I give that to every patient.
Awesome.
And it's just wonderful. People love it because, they can go home, their family can meet me, they can watch it. Some people watch it 10 times. They send it to their kids in California across the internet. But that way they really know and I don't get questions anymore about what are you doing anymore. That's all gone. They said, no, I watched your video. It makes perfect sense. So that's how we started into social media. But as far as do I get a lot of patients? I mean, once in a while, somebody will come and say, yeah, my daughter follows you on TikTok and says, go see him. And so, so they'll come and see me, but it's minuscule, really. I mean, the referrals I get from social media aren't a lot, but I think we've had an educational component that we enjoy, teaching people about neurosurgery and what we do, just like you do, days in life, and talk about procedures and things like that.
Yeah.
Do you see much referrals increase from what your social media?
Yeah, I do. I have quite a few patients that come in. Just they'll come in and say, "Hey, doc, I feel very comfortable with you, and I feel like I know you because I've watched
That's great.
a lot of your
Yeah.
videos." Yeah, but yeah, you're exactly right. You have a patient that comes in, and you kind of try to explain to them, what spinal stenosis is or
Right.
radiculopathy, and they have no idea. So I think it's good to have something that you can share with them because all they're going to do is go home and Google it, and
Right.
yeah, exactly.
they may end up on some other surgeon's website. So
Well, they do. And,
yeah.
and don't you hate that when they come in and somebody says, well, I watched the video and this is how they do it. And then you have to say, but that's not how I do it. So I'd rather
Yeah.
them watch my videos to see exactly the way that I do it. And it's just been a game changer for my patients. And then in the morning when we're rounding at, 6 o'clock in the morning, and you got to go fast to get the surgery. I can politely say, everything is in that video and they know it is. So they'll watch the video at home about all the stuff I would talk about at 6 o'clock in the morning that they won't remember.
Yeah,
So
that's exactly what I do too. Yeah, every
yeah,
single patient, they get an email from me, my personal
yeah.
email, and it has their condition, it has their diagnosis, the procedure, and a video of me explaining what we'll be doing. So, and then email me or bring questions back when we meet again. So I think that's
Yeah.
really
I think people feel a lot more comfortable too when they have all that and they're making an informed decision about their healthcare, not just
Yeah.
being told like you need surgery. I think another huge aspect is just the post-operative care. Anyone who's helping them
exactly.
out
Yeah.
can also watch that. But like what you were touching on too, I think is so powerful about social media is now if you don't just have that, but people feeling more comfortable, they feel like they've seen you before. So that's a huge part about picking a surgeon. I think you have to like the person somewhat. Which instead of having 15 minutes, they can watch a lot more before they come see you, which is cool.
Yeah.
But I just thought it was so cool because, yeah, you had to be doing that when there wasn't much. I was trying to describe that to him. Like short form wasn't a thing, or it
Mhm.
wasn't, TikTok wasn't big at all, and none of the other ones existed. It was more so YouTube. And like us younger people, like I've always watched YouTube. And
Yeah.
I think I just don't know. I know like Dr. Mike was probably on back then and a few of the other, but there probably were not many, if any, surgeons on there.
No, not when I first started. And I started actually with my cell phone, just picking up my cell phone and started recording. And I took it from there.
Yeah. I mean, there's a good lesson just getting started. But
Yeah.
um, well, have you ever had any issues with like in residency or now in terms of recording anything like with social media?
Like in the
Uh,
hospital?
Nothing that I can particularly remember. I know it is really important to just check with hospital policies and make sure that you know you, um, you're okay with filming and patients are okay. And I actually got this from my fellowship program. For every patient that comes into my office, as part of their registration package, filling out the paperwork, there's a media consent form, and they can opt in
Mhm.
or opt out for that. So, and it gives me permission to film certain parts. But if it's a surgical procedure, then I'll get something else in writing also that they give me permission to record that.
Yeah,
I haven't. I can't think of anything in particular that I've had any issues. Just try
yeah.
to.
Yeah.
Yeah.
That's
I mean,
very nice.
that's
Yeah.
a great, yeah, that's a great process. Do you operate at multiple different hospitals?
Mainly two, and one of them is a physician-owned hospital. So I actually part owner there. So I don't get any issues or problems with the that hospital. But the bigger
Yeah.
hospital I operate at, I just generally have to get things signed off and approved. They'll let you rent the operating room. You just have to
Mm.
pay a small fee to use.
Wow.
So it's a HCA facility, but I've paid to like go in the operating room before and kind of use it for a few hours.
Oh, that's really
I think that's
interesting.
what she was mentioning to me.
Oh yeah, because that's something just we've been kind of navigating and trying because that's a good thing if you could
Yeah.
rent an operating
Our
room.
hospital system has a little more stringent policy about
Yeah.
filming in the hospital, so that's been a little bit of an issue, and so we're working on it. But I think they mentioned something similar to that
Yep.
potentially.
Yeah.
Yeah, but that's still like, that's a
That's
good
a good
word.
idea.
Yeah.
Yeah. So tell us about you. Like, what are you married or have any kids, or what do you like to do for free time? Sounds like you're busy, but
Yeah. So married, I have three kids. One is 2, 4, and 12, or
huh?
13 actually. Uh, so pretty busy household when I get home. When I get home, I go into my second job, which is being a
Yeah.
father and a husband. So it's a lot of fun. It is pretty, as you probably remember from when your kids were younger. It can be a handful. And my wife, when I get up, come home, she wants to just hand me the kids and
Right.
take off. So I try to get all my work done before I get home. And I'm an early riser. I wake up at 4:30 every morning just to have some peace and quiet and
Yeah.
complete some work. So, but outside of that, love to travel, love to work out. I train 2 or 3 times a week with a trainer early morning. Um, what else?
So
Film.
what's typical workout for you?
It's mostly just core calisthenics cardio. So we don't
Uh-huh.
do really heavy weights. Just a lot of core exercises and flexibility. So we spend a lot of time in kind of in a flex position in surgery. So, and he
Yeah.
was really good about picking up on that. He was like, "You spend a lot of time like this. Everything posterior is really tight and constricted, and we need to work on that." So that's all he does is try to get me to work on my posture and
Yeah.
core. It helps in surgery.
What do you so I get a lot of people ask me like what's good for my back? Like what exercises should I do and what shouldn't I do? And you probably get a lot of that, maybe more so than I do. Like what do you tell people?
Yeah, I tell them that, the best things that in my experience for back is working on your core, making sure your core is tight and
Yeah.
strong. So any core exercises,
Yeah.
and also keeping your weight down to keep
Yeah.
the pressure off of those parts of the spine. But specific work exercises, I always go back to that core. I mean, if your core is weak, you're going to have back pain.
Yeah.
Uh, my personal experience when I was in the military, I injured my back. So for the last 20 years, I've had some issues with my back. And when I work on my core, that's
Yeah.
really the biggest difference I've learned. That's really helped me. So I try to preach that to my patients.
Well, it's such a big problem too, because the majority of people that come in, I mean, so many people have back pain and complain of that and neck pain and on a chronic basis. And there's just, most of those people don't need surgery and there's just not a good way to alleviate it completely. And
Yeah,
someday somebody will figure it out, but right now it's a tough thing to figure out how to help people with their back pain because everybody's so different, and what works for one person doesn't work for the next person. And
Yeah, that's exactly right. And, just trying to figure out what's actually causing it. Is it the disc or is it
Yeah.
stenosis, instability? There's a lot of different facets,
Yep.
different causes of back pain. And
Muscles, tendons, ligaments. Yeah.
exactly, that's what makes it difficult.
Yeah. Well, no, and a lot of times too. I mean, it is as you get older. I mean, I feel like you even have to put more work into. You can get away with a lot of things when you're younger, but
Mhm.
as you get older, like doing the mobility work, the stretching, the core work, working out, it becomes more important, not less important, and you got to
Exactly.
put in that work.
Yep. Yep.
But I feel like in your or what I've seen too is I'm not sure if it's the proper, but you have a fellowship. Is it the Dr. Antonio Webb Fellowship? Or I feel like that's a big component of what you do as well as giving back. And you said you had a mentee. How does that, or what are your feelings towards that?
Yeah, I think that's important. Just because growing up, nobody in my family was a doctor. I really had to figure this whole path out and kind of try this didn't work, try this didn't work, and until I actually got here. So I have a huge passion for kind of giving back and mentoring. So I have a nonprofit, the Webb Family Foundation, and it essentially is to increase or provide mentorship and guidance to students that are coming up behind me. So I have a summer program that I do where students spend some 2 weeks with me in surgery and in clinic. And this past year, I had about 100 applicants for that program. And also, I have a health event, a health day camp this weekend, actually on Saturday. We have 90 students registered so far.
Oh, nice.
I have, I think it's about 15 doctors that will be there: plastic surgery, allergist, pulmonologist, family medicine doctor. And we'll have some hands-on, some saws, drills, hammers, screws. We have a heart monitor. They'll listen to heart sounds. I have some suturing kits for them. So really just trying to introduce the students into the field of medicine, because a similar program to that got me interested in medicine and is really the reason why I'm a doctor. So
Yeah, no, I think is that for like junior high, high
Yeah,
school
age
age
group, yeah.
students?
yes, sir. Middle school and high school and some college students, but really middle school, high school. That's where I really want to impact them.
Yeah.
Yeah.
Well, because like you were saying earlier, you went after you did that in high school, that program you were very interested in. I think a lot of times it's just exposure to the stuff,
Yep.
and people seeing what the possibilities are out there. 'Cause there's certain fields you just don't really see as much.
Yeah. Yeah,
When
and
you,
I grew up a really challenging background in Louisiana, and I have several family members that went to prison. My mom was actually shot, and she's a T10 paraplegic due to her drug addiction. So just growing up around that type of environment, and I didn't have like any role models. There was no YouTube that I can
yeah,
consider a doctor that looks like me and say, hey, I want to do that. So I think that's
I mean that's awesome. How do you think it was that allowed you, or what traits that helped you kind of progress and decide you wanted a different outcome out of your life?
Yeah, that's a good question. Just a little bit of background. A little brother that went to prison for 5 years. My little sister went to prison. My dad was in a gang when he was younger. He went to prison as well, like sold drugs and used drugs. Cousins that went to prison, a lot of friends, family. So, but it was a program in high school similar to the one I'm having this Saturday that introduced the field of medicine to me. And otherwise, I wouldn't know it would have existed. And it was me and my best friend, who's a cardiothoracic anesthesiologist. We kind of stuck together and kind of stayed away from all the bad things that were happening. And we did that program, and ever since that program, we wanted to become doctors. So he's a cardiothoracic anesthesiologist out in Alaska, and I'm here in
He's
San
not,
Antonio.
he's not on Alaska.
What's
Yeah.
interesting about that is that why you found that drive to
Yeah.
do something different and move on in a different path compared to your brothers and sisters, and why does one person do that and another person can't,
Yeah, I get asked that question a lot. I mean, I can't explain it. I was very
Yeah.
focused. I mean, I've always been
Yeah.
very focused, and if I see something that I want to accomplish, yeah, there was really it's going to be nothing that's going to stop me from doing it. And I just kind of stuck with it over the years. And I knew going into the military, I can get out of that environment. So I joined the military at 17 years old and left Shreveport, Louisiana. So
I mean, I think it's a great example of if you set your mind to something,
Yeah.
you can make it happen. Because I would say you had a major roadblock to an ordinary person of what was possible. But
It's usually something in life that sets you on a different trajectory, I think, for a lot of people. For me, it was my brother getting in a car accident and having brain surgery in the middle of the night, and lived in a nursing home the rest of his life and couldn't walk or talk. But that's what really channeled me into neurosurgery. I mean, I was all signed up to go to college for marine biology, and when that happened, I canceled my classes and decided I wanted to be a neurosurgeon. Like you said, I just focused on it, and that's what I did.
Mhm.
So I mean, but usually some event, I think for a lot of people, something must steer you that way, different than other people.
Yep. Yeah. I definitely agree.
But I think
Yeah.
too, if you said you've always been very focused, and that's how my mom would always describe my dad. If you want to do something, you set your mind to it and do it. And I think that's like one of the top qualities of a
When you
orthopedic
were
surgeon.
when you were younger, what'd you do? Like I had paper routes and would shovel snow and
Oh,
all kind of stuff like that. I bet you were like that, or I bet you had something that you had to have responsibility for all the time.
yeah, I was always kind of on the go. I actually
Yeah.
worked at McDonald's when I was young, at a watermelon stand. That was actually my first job, and always trying to figure out over the summers what can I
Yeah.
do to kind of stay busy. So, yeah, definitely.
um, Switching gears a little, what would you say is your favorite part or the best part of being a surgeon, and what would be your like least favorite or the worst part?
I'll start off with the least favorite part first. I would say the least part is just the behind the scenes things that go on at patients and everybody else that doesn't see. The dealing with insurance companies and prior authorizations, denials.
Computers.
Yeah, the whole admin part, computers exactly. I enjoy that the least. That takes quite a bit of time, and people just don't really see that. And it takes a lot of time to that administrative burden that people talk about. But I think when I get my greatest joy is when patients come back and they're nearly in tears, like, "Hey, doc, you really changed my life." I was suffering with this for 4, 5, 6, 7 years, and you did a procedure, or even something conservative like physical therapy or an injection. After recommending that, and it can be life changing for a lot of people. So,
Yeah.
I
He
enjoy.
asked me those two questions in a TikTok and I answered the same way.
Yeah,
Computers was my least favorite. And then just what you said, seeing people come back, how you change their lives and they're so appreciative. That's definitely far and beyond. Because some people thought it should be, what's the least favorite thing that I like? Somebody said like, well, don't you, I mean, talking to families and telling them bad news, isn't that the worst thing? It's actually not for me because I think it's a good thing to help people come to ease their minds about something bad that's happening. If you can help that family get through a bad tragedy, explain it to them in a way that makes sense to them and make them not feel guilty about it, I
yeah,
think that's a positive, not a negative. So for me, I said computers, and a lot of people shot me down for that, like it was very insensitive. But delivering bad news is part of what we do, and you can turn that into a positive for the family or negative. But
yeah.
that's how I answer, just like you.
I agree. Yeah,
Well, I think there's so many things too. Like with growing up with my dad being a neurosurgeon, some people just think like, oh, surgeons like they're this or that, they're arrogant, or they make so much money, or this and that, and it's like people don't see how much there is that goes behind being a surgeon. All the other things you are doing that aren't technically just operating on people. Having to tell someone they're paralyzed or something else, like there's heavy components to that, and all the training you guys have gone through.
yeah,
So
yeah,
I think it's good too. I think people are always interested. A lot of times when we do social media, it's just stuff that over the years from just hearing friends or people I meet, what they would wonder. And those are just how I generate questions.
And like even for you, I think it's important. Like people always ask how does your family feel about you never being home? Because when I was younger, I was very busy and never home.
yeah,
But it's nice to hear these guys say, they always understood, they knew what I did. Now these older, Kevin says, I understand what my dad did, and it's something to keep in mind with your kids. Your kids are young, and you're not going to be there for a lot of things, but they do understand as they get older what you're doing and the importance of it, and
yeah. Yeah, I can already see that in my youngest. As soon as I walk in the house, he was like, "Daddy, you were at work," and he's 2, so he understands that. And I'll say, "Hey, I'm sorry, I had a late night, and I was helping someone at the hospital."
yeah.
So they do get it, but
Yeah.
I took a lot of trauma call my first 2 years in practice, and that was a pretty busy lifestyle.
Yeah.
I was not home a lot, so but I'm pretty sure you're still taking trauma call or
Yeah, we do a week at a time, which is just, it's horrible. It's a horrible week, but then when it's over, I mean, horrible as far as the hours and just you're there all the time and, you're up all night getting calls or getting called in. It's just, it's one of those weeks that when it's over with, I'm happy to move on to my elective life.
Yeah.
Yeah. Wait, do you still take trauma call then, or it's just not as bad?
I don't. No, I don't take any emergency call. I take call for my practice, and we have a spine surgeon, so we just split kind of call weekend. So if there's a case over the weekend, just someone who calls in, or I got a call yesterday from the emergency room about one of my previous patients, stuff like that we take care of, and nothing at the hospital is. Yeah,
How do you guys rotate practice calls? You said there's 9 or 10 other surgeons.
yeah. So it's we take a weekend at a time. So during the week we're responsible for our own patients, and then on the weekend we just take turns. Covering each other.
So you guys they have a lot of practice calling.
That's okay, man.
No, I'm saying because you've usually had what, 3 partners or 2 partners?
Yeah, it's always because with our groups have always been smaller. So, at one point for 17 years, we were just 3 of us at level 1 and it was busy. So it's just crazy. I mean, it's every third night and then every third weekend. And
yeah.
It's not like that, but we have our practice call, right? Like I'm on practice call right now, which is not a big deal. And then your week of trauma calls, very busy, but I don't know.
And I'm assuming, I don't know if you guys like rotate or with having several partners, but do you have your own like PA, or do you guys with that? Because you guys are like private practice, or just your group is, I would assume.
Private practice. I have 2 nurse practitioners that work with me.
Yeah, well, because I think a lot of things it's a good. A lot of people don't pay attention to necessarily, but like as surgeons, they think you guys are just doing everything too. But like that's a huge. I know you love Jenny, your PA, invaluable of helping make everything work. And he's always said that too when we were growing up, or when he talks to other people that are interested in stuff. There's lots of great fields to go into within medicine where you can still be necessarily around surgery or some of that without actually necessarily, if you don't want to be a full surgeon, because some people don't.
Yeah. There's a lot of other great opportunities, and like this weekend, I have a physical therapist that's coming. I have I believe there's a dietitian that will be coming. So just exposing kids to all of the career fields. There's lots of them, things out there that they wouldn't necessarily.
What's the future hold? Like, what do you think for your future? You have any exciting ideas that you want to do with your career, or
I think I'm interested to see kind of where this whole AI thing kind of comes and goes, and I think from a kind of using AI to kind of predict which patients will benefit from a particular surgery. Which patients will be kind of too high risk by putting all this information that we gather into some system that can give us a score, some type of scoring system. Hey, this patient's high risk. Will do better with the fusion versus a laminectomy. And
so some kind of standardization, because we have no standardization right now to some extent. It's really individual. We make, we decide what we think we should do individually.
And if the more it is, but no, in healthcare, it's harder for, I feel like, AI to move as fast compared to other fields because so much of the data is like restricted. You can't just give free reign of data. So it'll be interesting to see how that progresses, because I think that's, the LLMs and everything else in like tech, it's because they've got so much data they're pouring over, and that makes it the model better in all those regards. So
and then outside of that, I actually have an online course for doctors coming out here.
What do you have?
Oh, cool.
What is it?
So it's an online course that teaches doctors how to use social media and supplement their practice. So it's called socialmediafordoctors.com.
Let's check it out.
But for everyone listening, we'll put all these things we've been talking about in the show notes, and you can find them there for anyone interested in this stuff.
Just curiosity, like what's your favorite case to do? I know, you probably do a plethora of cases, but what's like, if your ideal day of surgery, like, some days you look at your schedule and I'm going, what was my scheduler thinking? And it's a very stressful day. And then there's other days I look at my schedule and I go, wow, this is a nice day. Like, what would be a nice day for you?
Good question. I would say anything anterior, ACDFs, artificial disc replacements, A-lifts, artificial disc replacements. So anything anterior for me is a good day. But those are my favorite surgeries. Yeah. What about yourself?
Probably like a nice clean lumbar fusion in the back, followed by, so my typical day would be like a lumbar fusion, then a multi-level lumbar decompression, and then an ACDF or posterior cervical. I don't know. I've noticed like when I was younger, it never seemed like the posterior cervical foraminotomies bled so much. I don't know if you get that, but then, like the individual foraminotomies, the epidural veins, the bleeding nowadays, it just kind of turns me off a little bit. It's just, do you get into that?
Yeah, it's probably, I'm wondering if it's something to do with patient's weight or blood pressure. I don't know. But I do see that pretty frequently.
Because, when we trained, we did everything sitting, everything. All our cervicals were sitting, posterior and any posterior fossa cases. And then when I came to town in 1999, the anesthesiologists here were very skittish about sitting position. So everything has been done prone, but you get more bleeding, obviously, when you're prone compared to sitting. But it seems to be like the standard of care at this point. So.
Yeah, and I'm also curious about the ergonomics, doing this for so many years, kind of bending your head down.
Yeah.
A lot of new systems are coming out, so you're looking at the monitor versus looking at the patient or through a microscope. So, but I've only been in practice for 4 years, and I can already feel the effects in my.
Well, they got these new. So for anybody out there, loupes, we call them loupes, the magnifying glasses that we wear. So mine, I do have to look down, but one of the guys that is in my group, he has. You just look straight ahead in it, so you can look straight, but you're seeing the field. It's pretty cool. I thought about maybe getting them, but Jesus, I'm almost 60 years old. What's the point at this point?
Yeah, it's I know those. They also have what's called the exoscope. It's very similar. You wear these glasses and you're looking up like this, but instead of looking kind of down.
So. Yeah.
Have you noticed though, like any times like where your neck?
I mean, my neck and back get sore when I'm in certain positions, but for the most part, I don't have a lot. I don't have neck or back pain. There are days where I'm sore if I'm bent over all day. You're right, but God knows what my neck looks like on an X-ray right now. But I don't know. I don't really have much pain.
Yeah. What about? Do you ever get? Whenever I ask him this, he's just like, I get through it. But do you ever get tired when you're like standing for operating all day?
Yeah, that can certainly kind of come into play. Yeah, I mean, it can be pretty exhausting, especially if you're doing some complex cases. That's why I like the straightforward cases: get in, get out, and take a little break, and get back at it.
Yeah, yeah. And what about what music do you like listening to in the OR? Everyone.
I usually let the nurses decide.
Oh my God, you guys are twins.
Sorry, we're twins. We do the same thing.
Oh my God.
Yeah, I never want to be the person whose music is this, and they look at me. So
there are certain things I won't listen to. Like there's a certain music they turn on, and I say, "Can you please just change channel?" I mean, once in a blue moon, but for the most part, I listen to anything. Like really twangy country, I don't like, and a few other things. But.
Yeah. Listen to pretty much everything kind of throughout the course of the day. So it's but in my fellowship program, my mentor, Dr. Isidore Lieberman, he would have everybody sing. It escapes me right now. There's a certain song that's very popular, so he has that song on every end of every case, and we would sing it. I can't think of the name right now.
He'd make you all sing along?
Oh yeah. Everybody had to. Let me see if I can find the name of it.
No, because
it's funny because some people don't think, as you on social media, a lot of people think that we don't play music. We just, you're focused the whole time. Nobody talks. And it's not like that, I mean.
What?
Sweet Caroline.
Oh, Sweet Caroline.
Oh, yeah.
Nice. I mean, everyone has to sing along to that.
Yeah.
Yeah, so we all, at the end of every case, that's what the song that we sung. Neil Diamond.
That's great. No, but like he was saying, I think the first time I saw in like popular media where I'd have some people asking about that because no one ever said anything was after what's it called? The Marvel with
Doctor Strange. He's talking about Doctor Strange.
Yeah,
that movie. Yeah,
he's like operating. They're listening to music, and people are like, "No, what?" I would have friends that, "Does your dad do that?" I was like, "Yeah, they always listen to music or something." I was like, "Do you think people are just always like just sitting there, just a dead silence?" I don't know.
It's pretty interesting. One of the neurosurgeons at my hospital, I mean, he listens pretty hardcore, like metal, hard metal music. That's what he is. It's just I can hear it
Yeah.
next door. It's just really loud. I was like, holy crap! I mean,
Gonna knock on the wall and be like, turn
yeah,
it down, buddy.
I'm surprised the anesthesiologist doesn't make him turn it down, because I've turned the music up once in a while here and they'll turn it right back down.
yeah. But sometimes I imagine sometimes they probably do try to.
Yeah.
Yeah, no, it's funny. It's like the obvious things. That's why it's always intriguing, like for like YouTube and social media, trying to find those things that are like so obvious to you guys, but other people would just be like, "Wait, that's really cool," or
Yeah,
this and that.
yeah,
It is interesting. I think it is, what I found out with social media is how a lot of people really don't know what we do, because it's a world no one's allowed into,
yeah,
for some reason. And especially like in the operating rooms, people aren't allowed in there. You're not even allowed back through the doors that head to them. And so people really never have an idea what we do, what goes on. And it's cool when we can show them that side of the world that they don't get a chance to see,
yeah. I mean, that's exactly right. Yeah, people they want to know even what doctors do, kind of on their time off. I mean,
Yeah.
that really fascinates a lot of people. That's actually probably one of the most popular requests that I get. Hey, let me see you at home with your kids, and there's certain things I'm little no, it's probably a little bit too personal, but
Yeah.
I try
Yeah.
to give them a glimpse as much as
How's
I
your
can.
wife? How's your wife with the social media? Does she like you doing it? Not like you doing it?
She's okay. I mean, that's an outlet for me. I mean, I've always had a passion for like cinematography and film. Actually, during fellowship, I hired a film instructor to work with me. But I have a whole team of people now that I don't really touch the camera. They just basically show up and do everything for me. But my wife is she's pretty supportive. She doesn't like to really be on camera a lot, but it's just really me. So
Yeah.
Yeah. Well, I think too, you're definitely further along like the journey if you figured out a lot of those things. Like, but you just like you said, you started with your phone and everything. Now I've seen you have like you batch content days. It
yeah,
seems like and
yeah,
shooting stuff.
yeah. Typically, we'll shoot like yesterday. We shot maybe 10 videos, and then
Yeah.
my videographer editor slowly release it over the next couple weeks, month or so. That's the only way to do it with our schedule like this.
Yeah, because he would say that at times it's just like you're so busy at first it's like it can be fun and enjoyable, and then when you're too busy and then you're trying to do stuff it gets
Yeah.
like in terms of I feel like that's how anyone who gets further along in just content creation of any sort is you have to batch things together, and
Yep.
you always want to make it that's something we talk about a lot is just like, hey, if we don't want to do something, let's not ever make it like it's forced, because then it just
Yeah.
takes all the fun out of
Because
it,
I don't
which
want to
is
get to the point where I just have to make something just to get something out, there, because then
Yeah.
that defeats the purpose,
Yeah.
So sometimes we'll go a while without putting anything out because I'm busy, he's busy, and I'm not going to put something out that's junk.
Yep. I agree.
Oh,
Yeah.
yeah. Well, we sure appreciate you taking the time to
yeah.
talk to us. It's been very nice meeting you.
You too. Yeah.
Sound
Thank
like
you,
a
Doctor.
great person, a great surgeon.
But yeah,
Yep.
go everyone check out Dr. Antonio Webb on YouTube, TikTok, Instagram. He's on all those platforms. We'll put the links to all of his stuff and the other programs we discussed
Yeah.
for anyone interested. And yeah, thank you so much for your time. I thought that was a great conversation.
Yeah.
So,
Yeah. You're very welcome. Thanks for having me. Appreciate it.
Yeah.
all right.
Thanks.
Yeah.
Thank you.